Okay.
Okay.
Hi, everybody. Welcome to the webinar organized by the Distance Education and E-Learning Working Group of the FLM. And thank you for your participation. I am Diler Aslan from Denizli. Today's title is Essential Leadership Management for Laboratory Professionals. As a 40-year clinical biochemist, I can say that this is the most important subject, especially in preparing to the future of the laboratory medicine. It's an honor for me to introduce my dear colleague Sedef as the speaker of this presentation. Sedef Yenizce is professor in biochemistry and laboratory medicine. She is working at the Demiroğlu Bilim University in Istanbul and division head of the Central Clinical Laboratory Services and the Associate Director of the Tissue Typing Laboratory Services at the Group Florence Nightingale Hospitals in Istanbul. She had accreditation experiences by steering 6 cycles of quality accreditation. She has also experiences on MBA training on executive management, over 25 years experience in management, over 30 years experience in teaching. She has authored chapters in textbooks and published in peer-reviewed academic journals. Her research and teaching related to the clinical laboratory management revolve around the quality management system, quality improvement techniques, medical test utilization, and leadership development. Her scientific work has been recognized through many national and international awards. She has deep scientific responsibilities. She has been a chair of the IFCC Committee on Clinical Laboratory Management since 2014 and the chair of the Laboratory Management Committee at the Turkish Biochemical Society. Most recently, she authored the monograph that the title is Leadership Basics for Clinical Laboratory Professionals, along with CCLM members. On this occasion, I would like to congratulate and thank to the committee and Sedef for this terrific training monograph. It is seen from your handout that your presentation will show an invaluable pathway to our society, Sedef. Before starting, I want to give some explanations about the questions to the participants. There is a question and answer icon at the lower side of the screen. Please activate it by clicking on. You can write your questions there during the presentation. I will collect and group these questions in order to redirect to Sedef after her presentation in the question and answer session. Thank you for your participation again. The microphone is yours, Sedef, please.
Thank you very much, Diler, for your nice introduction for me. And I would like to start immediately by introducing the learning objectives of today's webinar. As you very well aware of that, the laboratory medicine, the territory of the laboratory medicine or the landscape of the laboratory medicine is now changing. And as the laboratory professionals, we have to keep up all these changes by developing ourselves also in terms of the management and gaining the skills for the leadership. So by the completion of this webinar, I'm expecting you will be able to understand why laboratory professionals should have leadership skills. And I'm going to describe you a leader development framework for specifically I designed for the laboratory leadership. Then you will be able to explore the 4 self-awareness archetypes. And then I'm going to identify the different leadership styles and situations where they work best. And then, and in addition to that, I'm going to mention about the qualities and skills of good leaders required in the clinical laboratory management, and follow with the essential concepts for effectiveness of the management of people and workplace relationship. And I'm going to finish my presentation with outlining some of the key differences between leadership and management, and I hope that you will get benefits from that as well. And now let me start off defining the leadership first. Leadership can be defined by the ability to influence others toward fulfilling visions and goals. Leadership is a trait. No one is born with having leadership skills, or nor no one gained the leadership skills overnight. This is a trait based on individual characteristics that some are born to lead, whereas others are not. Example, communication skills or persuasive skills and being good at bringing about change. And then we have to get to know about the position. And the position means the functional role in an organization. Good leadership is rooted in how well it supports functions of an organization. And then, of course, when we define the leadership, we have to emphasize the power of the relationships, which is based on a particular leadership style or the effect of a leader, actually, on the behavior of a group. Also, how power is used and influence is leveraged to the greater good of the organization. Here you see in this slide the components of the laboratory medicine leadership. As you very well know that all these different roles, being the scientists and the visionary managers, promoter of the clinical laboratory, or champion for quality, or being competent practitioners, they all are related. The roles and the skills and the qualities and the characteristics are required for the clinical laboratory leadership. So we can define the good leadership in laboratory medicine, which is comprised of many factors and characterized by competency in practice, involvement in quality management, being an effective problem solver and strategist, one who pursues improvement, excellence in service, and promotes the development and sustainability of this service. And now, let's look at again, the challenges related to the leadership at the medical laboratory. As we embark on discussing leadership in medical laboratories, you can define it as a clinical laboratory as well. It is important to provide an overview of the service environment, driving forces, and context in which service is delivered. Two of the most important factors affecting healthcare today are rising healthcare costs and, of course, and the quality of services. These two must be addressed in order to produce a sustainable system. Many other challenges also face healthcare and need to be addressed, declining the reimbursement issues and or changes in payment schemes for services, changes in technology, advances in information technology and use of big data. And now we are going to deal with the artificial intelligence in near future, and it's already been on right now. And changes in technology, advances in information technology, and use of big data, as I said. And then influence of biomedical and genetic research promoting personalized diagnosis and management of patients. And then increase focus on an aging population and the chronic disease. And the changing population demographics, including age, ethnicity, race, sex, and gender. Again, I'm continuing the leadership at the medical laboratory because this is really important concept that we have to understand very well. The continued relevance of medical laboratories depends on its ability to adapt to an ever-changing healthcare environment. In this environment, there is emergence of new treatments, technologies, practices, and pressures. This requires a workforce and that is flexible with versatile skill mix and proficient in the use of technology. The key drivers of change in the contemporary laboratory include efficiency, turnaround time, quality improvement, and demand management. Many factors affect laboratory services and its primary outputs. And these are the staff capabilities and requirements, regulatory requirements, including professional, technical, and legal requirements. And then administrative and financial factors, and the need for more appropriate use of laboratory services, and service demands, including extending hours of operation, LIA's access and integration, expanded use of telecommunications for technical and clinical services. They are all blending now to generate the clinical laboratory processes very nicely. And then the main product of the laboratory is information. This is a unique feature of the laboratory medicine, because the laboratory medicine is only discipline that among the other medical disciplines that produces unique information. So the main objective of the medical laboratory is to provide the highest quality of information in the most cost-effective manner, considering all of these above. Laboratory services must be provided in an orderly, reliable, and dependable and timely manner. So here you see, again, this is a system, how the medical laboratory is established. And as you now you see how the leadership is integrated well with this system. Now let's get started with the first step, because leadership in this complex environment requires planning, critical reflection, and active involvement of all the stakeholders besides the laboratory professionals. This requires specifically from the clinical laboratory leaders that interacts with other frontline healthcare providers towards management and maintenance and development of medical laboratory services. And then the other responsibility of the clinical laboratory leaders or the medical laboratory leaders to develop strategies to improve staff productivity, reduce cost, provision of technical and clinical support, and development and interpretation of management reports, including that on utilization and impact on patient outcomes. And the other is the accountability, which means for managing of human resources, including recruitment, retention, and personal performance monitoring, and in ensuring that there is an appropriate blend of technical, medical, and supporting staff available within the system. And the next thing is to provide oversight for activities related to the laboratory information system and informatics, and leveraging this where possible to add value to services. This comes out of the understanding that major output of the laboratory is information, as I said previously, and realizing that it is provided in an appropriately and legible manner. And finally, it has to be visibly active, which means employee engagement, when I'm going to talk about it shortly, can be a challenge. So due attention must be given to the needs of employees as persons. This involves removing communication barriers and other hindrances inherent to the organizational structure. This requires the visible activity of laboratory leaders in all areas of operation. Not the least in determining the success of laboratories is an awareness of the needs of clients, the patients, the clinicians, or other stakeholders, and actively making use of this information for future planning and of services towards greater value and making full use of available resources to do so. So to make it short, I would say that leadership is needed at all levels throughout the laboratory system. Now let's look at the why, again, leadership matters in the laboratory. Okay, this is a new concept. It's an emerging concept actually in the laboratory medicine. So good leadership practices transcends disciplines, challenges others to growth and improvement, establishes workplace culture, promotes quality and progress. According to the study done by Gallup, it's an interesting finding that only 30% of people have the innate talent or can be taught to manage others effectively. This means identifying these individuals early and developing their abilities is essential for maintaining a pipeline of future laboratory managers as well, if we consider to develop the leadership skills, especially for next generation scientist laboratory leaders. And then another finding is a Center for Creative Leadership white paper found that more than half of new managers had received no management training prior to assuming their role. And it happens in the laboratory medicine as well. Over a quarter of new managers did not feel they were ready to manage others. So this paper lists numerous challenges that unprepared novice managers face, including motivating others, communicating effectively, and managing workplace conflict. So, as I said, clinical laboratory leadership challenges are unique. So we have to focus on well-being, and we have expectations, and we have to work for the safety of patients. But we have to deal with the patient safety, but rarely meeting the patient face to face. Well, balancing productivity and cost control with medical ethical requirements is also, that we have to deal with. But when we look at it in the past, the standard approach to selecting new laboratory leaders has been to promote high-performing line staff, as you might very well encounter this in your working environment. The problem with this strategy is that the skills and knowledge that make an effective bench technologies or the other positions are quite different from those that make an effective leader. Too often, employees are promoted without any preparation or training on leadership or management skills, then flounder in their new roles. This leads to frustration, of course, for both the leaders and those they lead. So essentially, we are setting up our future leaders to fail. The challenges of transitioning from an individual contributor to role to a leadership position are significant. So now I would like to invite you to look at the evolution of the leadership in medical laboratories. As you see here, that it happens more recently. So when we look at the CLS guideline, QMS01, and when we choose the quality standard element in relation to the organization and the leadership, So as we see that it corresponds also the other standards as well, which are published in ISO 15189 guideline. And it says in the clause for 1.1, organization and management responsibilities required. And again, in the ISO 9001 2015 emphasizes the leadership and the organizational roles and responsibilities and authorities for the laboratory leadership and planning of changes. And of course, the communication is important. And then again, ISO 17025 from 2017 emphasizes the importance of the management with overall responsibility. In addition to that, the importance of communication and management system requires are absolutely important elements. So that means we have to deal with this leadership characteristic and skills or whatever it contains inside. This is a broad area, I must say. So again, I would like to emphasize here the standard guidance in terms of the human resources sustaining standard of practice 5 is this actually identifies the role of the quality systems manager, and it refers to the quality officer in the ISO terminology. And this also describes the requirements for the effective leadership to actually pursue this role, and how the communication is required for this position in addition to the other traits. And here again, I would like to emphasize one of the important things that which is available in the QMS01, laboratory management includes laboratory leadership. It's now it's been emphasized here very clearly. And the components under the laboratory management, as you see, the communication is very important. And in terms of the organization leadership, again, the communication is very important component. And also the laboratory personnel. And when we're dealing with our stakeholders in the for instance, in the purchasing department, we need to use our communication skills. This is supposed to be a part of the our daily practice. I would like to actually say that mention the important phrase from the Thomas Cech, who is the Nobel Prize winner in 1989. What he said was, if I had one piece of advice to give, it's that although you have been hired for your scientific skills and research potential, your eventual success will depend heavily on your ability to guide, lead, and empower others to do their best work. So this has been said by him in 1989, and here we now in 2000, almost 20, and we have now to understand and recognize the significance of this leadership training and leadership management when we are dealing everything in the laboratory medicine. So now I would like again to bring your attention here, as we all aware of the Baldrige Excellence criteria, which is the most prestigious one. So they actually here say about the key expectations from the senior leaders in terms of the leadership. So this item asks about the key aspects of senior leaders' responsibilities with the aim of creating an organization that is successful now and in the future. And I'm not going into the details, but here, the first thing first, to set, communicate, and deploy organization's values and directions. Of course, we are familiar with these other things. And again, the communicate. So the communications is really an important skill to be gained for the leadership development. Now, we are starting with the framework. So leadership development for laboratory professionals requires a framework to identify priorities and make the right choices. Okay, so now I make this table for us to understand the levels of development for the laboratory leadership. And now, please see from the bottom to the up, because the leadership development training starts off from the managing self, which means the behavioral habits. So see, you see the tiers here represents the role of the person as a team lead or team leader, group leader, or team member or individual. And it depends upon the role that he possesses or she possesses in the laboratory. And this role should focus on some characteristics and some of the features here. And then what are the requirements for this role is stated right here. Now, if we start off from the very beginning, it doesn't matter what your position is in the lab, and the leadership training starts off with managing self. And then this means leading self first. So it focuses on the organizational citizenship, technical leadership, and role model. And what to develop and to lead self, leadership commitment is required. What this means is, do you want to be a leader? Are you willing to be a leader? So it means that someone does not want to be a leader. It's up to him or her. So first, the commitment is required. And then understanding the leader development framework is required, because we have to see this happen step by step. It doesn't happen overnight. It doesn't happen within a month or so. It requires a course of time. It requires to develop your skills by the time and by your experiences as well. And the role clarification, of course, would help to develop yourself and the core responsibilities and your personal leadership style. So you have to know what type of leadership or what style of leadership you possess. You have to get to know yourself. And then the upper level, when we go to the upper level now, is related to managing people. This is an interpersonal stage. This means that leading this position actually mostly relates to the leading others and projects, who are the project leaders, or who are the team leaders, group leaders, or vice versa. So this focuses partnership and credibility, influence and collaborations, and this requires to develop others. Now you develop yourself. Now it's the turn of developing others in terms of interpersonal styles, setting expectations, communications, and coaching, empowerment and delegation, and conflict management and negotiations, and team leadership. Today, you're going to sneak a peek how to manage yourself, which means self-awareness, then how to communicate effectively, then how to empower or engage your team members. All right. And now let's go to the rest of the table now, starting from the bottom, going to the upper level. And again, in terms of the managing people, now we're looking at the position for the supervisors or first line supervisors, you name it. But here the important thing is the person's job, the person's role is to lead the performance. Okay, and now we focus on the direction and results, building engagement while managing resources, including humans. And then for this leadership role, what is required? required to improve the work processes, including continuous improvement planning systems, work processes, project management, measurement systems, control systems, performance, again, management systems. All right, now the final level to reach is the managing work, managing the processes, sub-processes, or the main processes. All right, and this mainly actually connected to the positions of the managers or second line supervisors who are leading the departments and programs. And at this time, the focus on coalitions and collaboration and cross-functional management strategies. And the upper level goes to the executive or directive positions who are leading the organization or department or the institutions. And again, the focus here, the strategic stewardship and how to lead the organizational culture, which is a very important component. And let's look at the requirements rapidly. And here, the requirements to lead the working environment, the processes to establish the vision and direction, to create a customer or stakeholder, you name it, patient or clinician, whoever the current customer are, the customer-focused organization, guiding transformational change, improving organizational performance and productivity systems thinking, developing business strategy and scenario planning. And again, today, when you complete this webinar, you're going to learn how to do lead and manage, and you will learn the key differences between the managing and leading. Now, I'm introducing you a framework. This framework, actually, I made it up to actually introduce you the essential components of the leadership development, which I'm going to talk about today. And this forms the framework for integrated suite of performance skills, specifically designed to improve results for managers, laboratory managers, and laboratory leaders through the application of key behavioral, interpersonal, and process drivers. And now from the slide on, you will follow my presentation by just paying attention the component that I'm talking. So these are, the three components for the managing self, which are self-awareness, leadership styles, leadership skills, then managing people, again, the three components involving in this stage, engaging others, effective communication, emotional intelligence. And finally, I'm going to give you a brief explanation how to lead and how to manage together. All right. And now let's get started with the self-awareness. This is the first thing. You must not forget it. If you are new in the leadership training, first you have to start off managing yourself. We know that leaders need self-awareness to be effective. That is an understanding of their strengths, weaknesses, feelings, thoughts, and values, as well as how they affect the people around them. So, but that's only half of the story. Self-awareness is useless without an equally important skill, which is self-management. So as you see here, the components which are essential to do the self-management, because the self-management is a learnable skill, and this is how you can start. And first, you have to decide where you want to self-manage. This means you have to pay attention to how you typically operate, what you say, what you do, and what you don't say and what you don't do. Identify instances where your current approach is not working as well as you would like, and self-management might be useful in this, the first part. And the second stage that you have to notice and reflect on what's driving your lack of self-management. Excuse me. This means you have to understand why we make the choices we make is crucial to changing those choices. And then the third phase is to consider your choices and your reactions to those choices. We all have our default behaviors genetically, or we gained them later on. I'm sorry. So what else we can do? What is our reaction to those options? So we have to notice how our preferences and habits show up here and ask ourselves what we are trying to avoid when we default to those habits and preferences. Then we have to make a plan. Now we know what we want to change, better understand what's driving us, and we have identified some options. Think of concrete steps we can take. And then we have to do the practice. What we can learn from what we are doing and from what we are reacting, and that can inform our continued practice. Excuse me. And then we have to repeat those processes from the very beginning, starting from the second stage. And now this table shows the 4 self-awareness archetypes. So I'm not going into details here. I'm going to leave this table to you to examine your type of self-awareness. But here, pay attention, the horizontal line here, this shows the external self-awareness here. This means how well you understand how others see you. When you go to the vertical side, this represents internal self-awareness, how well you know yourself. So, okay, then read this out and now and then identify your self-awareness type. Again, now we have to know our leadership styles. We all have unique leadership styles, but we can develop it further. All right. In the 1930s, research revealed 3 styles for leadership. Autocratic type, leader makes decisions without consulting others. Or democratic type, involves people in decision making. And the third type is the laissez-faire type, which allows people to make own decisions. Today, more styles can be identified, and those are bureaucratic type, charismatic, task-oriented, people-oriented or relations-oriented, servant type, transactional or transformational type. So now I'm gonna explain you a little bit the differences between all these leadership styles. Leadership styles is the general approach taken when in a leadership role. This is a product of all our behaviors that we displayed as a leader in decision making, providing direction to people, implementing plans, and managing and motivating our staff members. So those leadership styles are flexible and can be changed depending on circumstances, but one may be used more often than others by a leader. Each style carries with its advantages as well as disadvantages. Amongst the leadership styles are the charismatic one shows concern for followers looking after the needs for followers. Participative or democratic type involves being a facilitator, people-oriented, and is based on the idea that people can be trusted to make valuable contributions when given the opportunity. And laissez-faire type is the delegative one, by allowing team members to make decisions. Laissez-faire is not always hands-off approach. Many leaders still remain open to group members for consultation and feedback, of course. And the situational type adjusts to changing circumstances, to cope with challenges, but requires the leader to know team members well in order to strategize a new plan through joining, coaching, delegating, or directing. The next is the autocratic type of leadership. It is characterized by control over all decisions, allowing little input from team members. And then the other one is the servant and quiet leadership. Serves followers and present themselves as examples. Quiet leadership involves the leader doing what needs to be done with hope of inspiring followers to do the same. Again, now we continue with the leadership styles a little bit, but now I'm introducing you the two most important ones among the others. All right, these are the transactional and transformational leadership style. These are two modern leadership styles that encompass elements of the other. Transactional leadership involves establishing a clear chain of command and exchanging rewards or recognition for effort and performance. It focuses on transaction or situation at hand and supports maintenance of the status quo. Transactional leaders motivate and guide followers towards fulfilling goals by clarifying roles and requirements for tasks. This leadership style is effective mostly in crisis situations or in the clinical laboratory, where rigid adherence to procedures and policy is required to maintain compliance with standards. Now, in terms of the transformational leadership, this closely compares with the charismatic style, which masters the art of influence and focuses on making change happen. The transformational leader is a visionary and leads by motivating through appealing to their followers' ideals and morals. They inspire their followers and empower them and are more likely to bring about positive outcomes in staff attitudes and performance, employee health, creativity, and patient safety. So transactional and transformational leaders are not opposing approaches, but are complementary. Transactional leaders handle day-to-day changes and challenges as they occur, but the transformational leaders build on strengths of transactional leadership by augmenting worker engagement, effort, and performance. Traits from both types are held by best leaders. So if you ask me what is the best time to use this transformational leadership, I would say that exactly when you are leading your team members. This is the most required leadership style for building the team up and the team management. Okay, now again, I'm going to say a couple of words for the transformational leadership style. Again here, the transformational leaders serves to elevate followers through 4 aspects. The first is the idealized influence. The leader being a role model and showing consistency in approach. This brings trust and respect from the workers. The other one is the inspirational motivation by establishing high standards and raising expectations by convincing followers they are capable of achieving and exceeding high standards. Here, a vision is presented and the follower is connected as a participant in the vision. And intellectual stimulation, which means the challenging followers to think and solve problems for themselves. This allows old problems to be examined in new ways, but also promotes development for future leaders. So the final thing is the individualized consideration, which means to recognize the individual by listening, caring, advising, and developing for the employees' own sake. This also entails compassion and providing due recognition. So to better understand ourselves, it is helpful to consider our motivations towards leadership. According to McClelland, there are 3 needs that drive individuals to pursue leadership positions. The first thing is the power. The need for power or authority is rooted in the desire to be influential and make a difference through leading and progressing personal ideas. While attraction to power causes some to leadership roles, this in itself does not guarantee success, as along with it must come a degree of flexibility and people skills. The next thing is the affiliation. Those who are motivated by affiliation desire good relationship and interaction. These are motivated by a need to be liked and to be popular. Therein is a flaw, as this motivation can undermine the leader's objectivity and decision-making ability. The final driver is the achievement. This is recognized as the strongest motivator towards making the best leaders. Achievement-motivated leaders seek challenging goals and job advancement they are driven to accomplish. A weakness of this motivation is a tendency to be over-demanding of staff, who are likely to be less achievement-focused. Such leaders are prone to prioritize achievement over the interests and needs of others. So let's now ask these questions to us. What kind of leader are you? All right, so now I would invite you, actually I would like to invite you to reflect on your leadership style. There are assessments, self-assessments that you could learn for your leadership styles. But to become an effective laboratory leader, the first thing you remember the self-awareness, and we must understand ourselves. Okay, so one way of evaluating leadership style is in relation to how power is exerted on the team. This has been described to fall on a continuum, as you see here, moving from the autocratic style to democratic style, and finally to laissez-faire style at the other extreme. The different aspects of these styles also find a place in clinical laboratory leadership. The leadership followership test also is available to get to know ourselves, and we have to do it to understand, again, as I said, to our leadership style. So to become effective leaders, we must first understand ourselves and how we react to particular situations. Now let's move to another topic within the managing self. This is the leadership skills. Again, the skills are so much and considerable information are available in terms of the leadership skills. And of course, what kind of skills you possess. Also, there are self-assessment tasks available for you. But here, I'm going to mention only the 4 leadership characteristics as essential for the future. The first thing is the insight. This means to facilitate group collaboration, and this skill helps to solve problems effectively, to make quality decisions, offer critical perspective, communicate prolifically and enthusiastically. And the integrity is very important skill that a leader must possess. This represents the role model of organizational values: to give praise, to be supportive, to develop others, to commit actually to develop others, to foster mutual respect. And the third characteristic is the courage, which means to remain composed and confident in uncertainty, to keep group organized and on task, operate with strong results orientation, to develop and share collective mission, to seek different perspectives among the other team members, and champion desired change. And the other one is the must skill in our modern era, which is the agility. This is a must to have as a leadership skill. This means to recover positively from failures, to clarify objectives, rewards, and consequences, to motivate and bring out best in others, to differentiate among followers. All right, now we are moving to the next chapter in the essential leadership development. This is related to managing people. This is the first component in this part, which is the motivation and engaging others. So this looks to you a little bit similar terms, but I have to emphasize here that to engage your colleagues or team members, you have to motivate them first, or you have to get to know your team members, how they are motivated, all right? So these are the key components that you have to keep in your mind when you are using the motivation to engage others. But before I proceed further, I would like to introduce you some important terms or the terminology, because I don't want you to get confused with these terms, all right? Although the concepts of employee engagement and job satisfaction are somewhat interrelated, they are not synonymous. Job satisfaction has more to do with whether the employee is personally happy than with whether the employee is actively involved in advancing organizational goals. So another definition, excuse me, is about the employee engagement. Actually, many of these definitions emphasize some aspect of an employee's commitment to the organization or the positive behaviors an engaged employee exhibits. Examples of employee engagement definitions include, here is a strand of the mental and emotional connection employees feel toward their places of work, or those who are involved in, enthusiastic about, and committed to their work, or willingness and ability to contribute to company or department success, and the level of employees' psychological investment in their organization. Excuse me. I'm aware that the time is running out pretty fast, and I'm now closing by the my presentation, and I'm going to go a little bit faster to finish it up, by the time that is allocated for me. And here you have to know what the motivation is. And before you get into the leadership development training, you have to learn about the terms and terminology. And this is what the motivation is. So basically, why do we do things we do, and what is it that drives our behaviors? So here, I would like to bring your attention that psychologists have proposed some different ways of thinking about motivation, including one method that involves looking at whether motivation arises from outside and extrinsic or inside intrinsic of the individual. So what leaders and individuals need to understand about motivation, why it matters. It matters because we are working in a team environment. We are dealing a lot of people, human beings, these are all our stakeholders. So we have to know how to manage the motivation or the engagement of our team members. So the question is here, how the people are motivated, but the people are always motivated. The question is not if, but why they are motivated. So then we learn how to motivate our team members. So here, there is another term, optimal motivation. This contains one's psychological need for autonomy, relatedness, which means purpose, and competence, mastery in the pursuit and achievement of meaningful goals that lead to positive and sustainable energy, vitality, and sense of well-being. Those refer to motivational drivers. So here you see all these motivational drivers are actually the gear wheels, and they all are feeding each other. The other thing that you have to consider is in terms of the engagement of the employees or our team members, there are two different drivers for the people. The first is the organizational drivers. In this part, 6 drivers of employee engagement that have the greatest impact, because the people are happy when the leaders of their organization are committed to making it a great place to work. So we have to keep it in mind. And the people like to trust in the leaders of the organization to set the right course. So now you think of the integrity here, you see, and the skill that you have to develop or gain further, and the belief that the organization will be successful in the future, understanding of how I fit into the organization's future plans. The leaders of the organization value people as their most important resource. The organization makes investments to make employees more successful. In terms of the management drivers, according to the Gallup Q12 elements, which link strongly to the key business outcomes, the employees or our team members have to have clear expectations and resources at their disposal, and also what the employee gives, the employee's individual contributions, whether the individual fits in the organization based on the department mission and co-workers, and whether the employee has the opportunity to grow by getting feedback about work and opportunities to learn. So employees enjoy a good relationship with their supervisor and have the necessary equipment to do the job well, have authority necessary to accomplish their job well, and have freedom to make work decisions. So in terms of the motivational framework, clinical laboratory, we all have to deal with as an individual to our colleagues, to our team members, and to our superiors, maybe a laboratory director, or to the top management in the organization, or and the patients, as well as the clinicians. There are all the stakeholders within our motivational framework that we have to manage. So if we have to give an example for the quality of motivation, this is let's think of a laboratory technician that spends extra time working for validation of a new analytical method because he or she wants better results for internal quality. So I'm asking you here a question: what do you think that this person has? What kind of motivation that this person possesses or uses to achieve this goal? All right. So this table shows actually what kind of behaviors cause the people to engage or disengage. I'm not going into detail here, but I'm inviting you to reflect on this questions. Are you clear what motivates your employees? What separates the motivations of millennials from previous generations? This is an important question. And don't forget that we have to deal with the next generation scientists and laboratory professionals. So they are the millennials, all right? So is money always a motivator, or can it even demotivate? This is another question as well. And I'm really expecting you answer those questions at the end of my webinar. Okay, this cartoon shows you a nice, actually, story about, you know, how the people are really getting motivated. So this is a fun, actually, when you read it out. All right. So in terms of the activating the optimal motivation with others, don't forget individuals are always motivated. The leader's role here is to help individuals explore why they are motivated, uncover the reasons for their current motivational outlook, and then use best practices to help facilitate people's shift to a more optimal motivation outlook. Yes, I have to finish. I have to finish. I know. Could you give me 5 minutes? May I ask for a further 5 minutes?
Okay.
Thank you so much. So I'm going fast. So I would like to emphasize the significance of the effective communication here with the phrase from the Winston Churchill, the difference between mere management and leadership is communication. So I'm not going into details, but I would like to emphasize the significance to learn the skills to use or to pursue or to carry out, you know, to communicate effectively. There are methods to do this, but I would like to bring your attention the common barriers to effective communication. Then I would advise you not to do it, of course. And the first barrier is the stress and out of control emotion. The second thing is the lack of focus. And the third is the inconsistent body language. And the fourth barrier is the negative body language. So we have to overcome all these barriers to be capable for the effective communication. So when you examine this cartoon, as you see, there is no communication going on between those two guys. Huh? All right. So managing people to do the effective, to gain the effective communication skills, actually, first thing first is to become an engaged listener, to pay attention to nonverbal signals, to keep stress in check, and to assert yourself. The next thing in terms of the managing people, to know the emotional intelligence. This is an important thing. Actually, this has been explored first in the mid-80s, and several models are now being currently developed. I would like to bring your attention here, a mixed model for the emotional intelligence that you are able to use, you know, to know about more on this emotional intelligence. So I'm just summarized here. The 5 key areas are required are self-awareness. You know, you don't forget it, never forget it. The self-awareness is the most important thing, and self-management and motivation and empathy and social skills. And I'm going to finish, you know, to mention about the differences between the leading and management. Leadership is an action, not a position. This is true, and this is the this is the Cotter model of management. This is John Cotter's model, actually based on his research. He published it several years ago, and you see here clearly how the management and leadership are different from each other in terms of those components. And again, this is not one size fits all role. Different personalities suit different roles for the management, but I'm inviting you to reflect on your experiences, as by asking those questions yourself. But when leading is needed and when managing is needed, these are the two sides of the same coin. As you follow these arrows here, some of them are interacting each other, planning and budgeting, aligning people, motivating and inspiring, but some of them are stable in terms of the change and to establish the direction. This is for the job of the leaders, and this is the task of the management, to produce predictability and order and organizing and staffing. And these next 3 slides will show you the differences in approach and setting out the mission for the management and leadership. I'm expecting you, read this out, because this is a really broad area to speak out on, and just, keep going very fast, but just pay attention what the management is and what the leadership is. Here, the leadership is focused on achievements and change, but the management is focused on results. And leadership is risk-taking and risk-averse, the other one, and this requires a long-term job, but this is a short-term one. And different ways to treat subordinates. Here, this is the key word here. The leadership views subordinates as followers. This is the key word, and never forget that. But the management views subordinates as employees, all right? So I'm expecting you read the rest. And here, this is a very good cartoon, giving you another picture about the leadership versus management. Now I'm leaving you with these questions. How good are you in leading others? Do you meet their expectations? What makes you confident that you are an effective leader? And what criteria you use evaluating your leadership performance, all right? So these are, how I conclude. So I give you a sneak peek about the essentials of the leadership training. This is a comprehensive field. As I said, it doesn't fit in 15 minutes or so. We have a leadership training program. We develop it within the IFCC Committee on Clinical Laboratory Management. We develop a curriculum, and we are teaching, and we have a lot of case studies for the laboratory specifically, and self-assessments, interactive educational workshops, and we are also performing webinars. And this is a module that you can, reach in our website within the IFCC. This is, how you can also get access to our monograph, and more in the pipeline, I would say. And now I'm finishing my webinar, and thank you so much for joining us today. I'm ready to answer your questions. Thank you.